Welcome to another video of Clinical Hematology Unit 3 White Blood Cell Disorder. Let's dive. 1. Morphological and functional disorders of white blood cells. White blood cells, WBCs, or leukocytes, are crucial components of the immune system. Any abnormalities in their morphology, shape, size, structure, or function, immune response, can lead to various disorders. A. Morphological disorders. These disorders involve structural abnormalities in WBCs, which may impact their function. Examples include Pelger-Hute anomaly, hyposegmentation of neutrophils; May-Heglin anomaly, large platelets with dual bodies in neutrophils; Alder-Riley anomaly, abnormal granules in leukocytes due to mucopolysaccharidosis; Chediak-Higashi syndrome, large lysosomal granules in neutrophils, leading to impaired function. B. Functional disorders. Functional abnormalities in WBCs can weaken the immune response, making the body more susceptible to infections. Examples include chronic granulomatous disease, CGD, defective neutrophils fail to kill bacteria; leukocyte adhesion deficiency, LAD, impaired migration of leukocytes to infection sites; myeloperoxidase deficiency, reduced ability to produce reactive oxygen species for bacterial killing. 2. Leukocyte disorders. Leukocyte disorders affect WBC production, function, or count. They can be classified as A. Quantitative disorders, abnormal WBC count; leukocytosis, elevated WBC count, often due to infection, inflammation, or leukemia; leukopenia, decreased WBC count, increasing infection risk, e.g., due to chemotherapy, viral infections; neutropenia, low neutrophil count, leading to bacterial and fungal infections; lymphocytosis/lymphopenia, abnormal lymphocyte levels due to infections, immune disorders, or malignancies. B. Qualitative disorders, defective WBC function. Hypersegmented neutrophils seen in vitamin B1, 2, or folate deficiency; dual bodies in neutrophils associated with infections or stress; toxic granulation, large granules in neutrophils during severe infections. 3. Leukemia. Leukemia is a cancer of white blood cells characterized by uncontrolled proliferation of abnormal leukocytes in the bone marrow. It is classified into A. Acute versus chronic leukemia. Acute leukemia, rapid onset, immature WBCs, blasts, aggressive progression. Acute lymphoblastic leukemia, all, common in children. Acute myeloid leukemia, AML, affects adults more frequently. Chronic leukemia, slow progression, mature but abnormal WBCs. Chronic lymphocytic leukemia, CLL, common in older adults. Chronic myeloid leukemia, CML, associated with the Philadelphia chromosome, BCR-ABL gene fusion. B. Symptoms of leukemia. Frequent infections due to dysfunctional WBCs. Anemia, low RBC count, leading to fatigue. Easy bruising/bleeding due to platelet dysfunction. Bone pain and swollen lymph nodes. C. Diagnosis and treatment. Diagnosis: complete blood count, CBC, bone marrow biopsy, flow cytometry, genetic tests. Treatment: chemotherapy, targeted therapy, e.g., tyrosine kinase inhibitors for CML, radiation, bone marrow transplantation. VVI MCQs. 1. Which laboratory test is commonly used to determine the total white blood cell count? A. Hemoglobin test. B. Complete blood count, CBC. C. Blood glucose test. D. Coagulation profile. Answer: B. 2. A peripheral blood smear showing hypersegmented neutrophils is indicative of which condition? A. Iron deficiency anemia. B. Leukemia. C. Vitamin B1, 2, or folate deficiency. D. Chronic granulomatous disease. Answer: C. 3. What type of stain is commonly used in the laboratory to visualize white blood cell morphology? A. Gram stain. B. Reit-Giemsa stain. C. India ink stain. D. Ziehl-Neelsen stain. Answer: B. 4. Which leukocyte disorder is characterized by the presence of large, abnormal granules in neutrophils on a peripheral smear? A. Chediak-Higashi syndrome. B. Chronic granulomatous disease. C. Leukocyte adhesion deficiency. D. Pelger-Hute anomaly. Answer: A. 5. In a patient with suspected leukemia, which laboratory test is most crucial for confirming the diagnosis? A. Urinalysis. B. Bone marrow biopsy. C. Liver function test. D. Coagulation test. Answer: B. 6. Which condition is associated with an increased number of immature white blood cells, blasts, in a blood smear? A. Leukopenia. B. Leukemia. C. Neutropenia. D. Polycythemia. Answer: B. 7. Which marker is used in flow cytometry to identify B-cell chronic lymphocytic leukemia, CLL? A. CD3. B. CD20. C. CD5 and CD19. D. CD56. Answer: C. 8. Which automated lab test can help differentiate between various types of white blood cells? A. Blood culture. B. Hemoglobin electrophoresis. C. Differential white blood cell count. D. ESR, erythrocyte sedimentation rate. Answer: C. 9. Which cytogenetic abnormality is commonly associated with chronic myeloid leukemia, CML? A. Philadelphia chromosome, BCR-ABL fusion. B. JAK2 mutation. C. Factor V Leiden mutation. D. FMR1 gene expansion. Answer: A. 10. In the laboratory, what is a key characteristic of toxic granulation in neutrophils? A. Large, dark granules in neutrophils. B. Absence of granules. C. Bilobed nucleus. D. Presence of dual bodies only. Answer: A. 11. Which leukocyte disorder is characterized by an absolute decrease in neutrophils? A. Leukocytosis. B. Neutropenia. C. Lymphocytosis. D. Monocytosis. Answer: B. 12. What is the function of myeloperoxidase in neutrophils? A. DNA replication. B. Bacterial killing through oxidative burst. C. Protein synthesis. D. Blood clotting. Answer: B. 13. Which laboratory technique is commonly used to detect leukemia-specific genetic mutations? A. Western blot. B. PCR, polymerase chain reaction. C. Gram staining. D. Agglutination test. Answer: B. 14. A patient with suspected chronic lymphocytic leukemia, CLL, is likely to have which finding in their blood smear? A. Smudge cells. B. Auer rods. C. Dual bodies. D. Howell-Jolly bodies. Answer: A. 15. What is the primary diagnostic laboratory test for chronic granulomatous disease, CGD? A. Nitroblue tetrazolium, NBT, test. B. Bone marrow aspiration. C. PT/INR test. D. Blood culture. Answer: A. 16. How is leukocyte adhesion deficiency, LAD, diagnosed in a laboratory? A. Flow cytometry for CD18 expression. B. Wright stain. C. Hemoglobin electrophoresis. D. ESR test. Answer: A. 17. What is the significance of the presence of Auer rods in a blood smear? A. Suggestive of acute myeloid leukemia, AML. B. Indicative of iron deficiency anemia. C. seen in bacterial infections. D. Characteristic of chronic myeloid leukemia, CML. Answer, A. 18. Which leukemia is most commonly associated with the presence of lymphoblasts in a blood smear? A. Acute myeloid leukemia, AML. B. Acute lymphoblastic leukemia, ALL. C. Chronic myeloid leukemia, CML. D. Hairy cell leukemia. Answer, B. 19. What is a key laboratory finding in a patient with leukopenia? A. Increased WBC count. B. Decreased WBC count. C. High platelet count. D. Increased hemoglobin levels. Answer, B. 20. Which stain is used to detect myeloperoxidase activity in white blood cells? A. Sudan black B stain. B. Methylene blue. C. Gram stain. D. India ink stain. Answer, A. If you guys like the video, then subscribe the channel, like, share with your friends, and don't forget to turn on the bell icon for latest update. Thank you.